welcome to Health Focus on GhanaWeb TV. Today we are diving into a topic that affects millions of women worldwide, but does not get the spotlight that it deserves. Polycystic ovarian syndrome, PCOS. Now, don't let a fancy medical name confuse you or make it sound like it's difficult. It's a common condition that affects women and their reproductive health. Today, we are going to bust some myths. We are going to receive some form of education. And we are going to talk about things that bother women when it comes to their reproductive health. My name is Stella J. Jomsogli, and I'll be doing this with Dr. Francis Beidu. He's a specialist of obstetrics and gynecology. After this break, we'll start the conversation. Hello and welcome back from that break. If you've been with me, then grab your tea, sit tight, and let's talk ovaries because they have a lot to say. Hello, Dr. Beidu.
Hello.
Let's talk PCOS.
Okay.
Before the conversation, I was telling you about how a lot of men do not know about PCOS, and even some women do not know about PCOS. So, first of all, to set the ground rolling, what is polycystic ovarian syndrome?
Okay. Thank you very much for the question, and I'm glad to be here to offer this education to our women in Ghana. So, as you rightly said, a lot of women and men do not know about this condition. And I would like to start by showing this very simple diagram and showing you the part of the woman's reproductive tract, reproductive organ, sorry. So with polycystic ovarian syndrome, we are mainly focusing on the ovaries. And if you look at this diagram, we have the ovary rightly labeled here. We have the tubes that carry the eggs through, and then we have the uterus over here where the baby would implant if there is fertilization. We have the cervix, and then we have the vagina. Now, let's look at the ovaries. Throughout a woman's menstrual cycle, every month there is release of an egg. And if fertilization does not take place, then it's shed at the menses. Now, in some women, what happens is that they don't ovulate, so there's no release of that egg. And eventually, what happens is that there are multiple cysts or fluid-filled cavities that are formed within the ovaries. And when that happens, it leads to problems with what we call endocrine issues, and then also issues with fertility. So basically, in simple terms, that's what we mean by polycystic ovarian syndrome. So there's just a lot of cysts that are formed in the ovary. Because of that, she's not able to have her menses. And then she also, because she's also not ovulating, she will also have difficulty getting pregnant. And then there are also other endocrine problems that arise from this condition.
Right. So when you were speaking, my first question, when you said, so she does not ovulate, why won't she ovulate? Because from my first thought when I hear polycystic something is that, you know how scary the word cysts sound. These days, they will tell a woman that you have ovarian cyst, you have a cyst on your kidney, you have a cyst somewhere. It sounds like, am I going to need surgery or, you know, all those kinds of things. So if you say because there are multiple cysts in the, where the ovary is supposed to be, and that's why the woman does not ovulate, what causes that, and what's the whole science behind that condition?
Okay, so really in those women, so every woman would ovulate. But in these women, what happens is that instead of the egg being released, it eventually forms a cyst.
So it's there?
Yes, it's there. So there is no egg that is, or there is no egg that is released to pass through the tubes here. They will just form cysts in the
Okay, I
ovary.
think we should show the picture of the cyst.
Yes. So if we look at this, other diagram, this is a normal woman with a normal ovary.
So every month you have one of
Yes.
one ovary.
Yes.
That's the
Releasing an egg.
Okay.
That will pass through the tubes and then come and lie inside the uterus. Now, in the woman with polycystic ovaries, what happens is that instead of the egg being released, they form multiple cysts. So if you compare this ovary, which is the normal one, to this ovary, which is the abnormal one or the cystic one, you can see that there's multiple cysts that are being formed in this ovary. And that even increases the size of that ovary if you compare the two ovaries and then the sizes. So there is just formation of a lot of cysts in the ovary. And because of that, the cysts that are being formed, there is release of certain chemicals and certain hormones. And that is eventually what causes a lot of the problems that these women will have.
Okay.
The clinical problems.
So now that we've established what PCOS, the whole condition or the science behind it is, what causes it? Why are the eggs not just going to where they are supposed to go? Because per the anatomy of a woman, every month you're supposed to release eggs. If the eggs don't get fertilized, they break down, you shed them as menstruation, and then you're done with it. Why are my eggs not going? Why are they there? And why are they forming, multiple cysts and causing problems for me?
So you mean you want the exact cause?
Why? Why?
There is no exact cause, but we know that this is what happens in some of those women. Instead of them ovulating normally, like ovulating, that means the egg coming out normally.
Yeah.
The egg does not do that. It just stays there and forms those fluid-filled cavities, which is the cysts.
Wow. So who is likely to have this condition?
Yes, so that's a good question. So it happens in women in their reproductive age.
Okay.
So any woman who is in the reproductive age, generally around the age of about 15 to 49 years. But we tend to pick it up mostly in women in their 20s and then their 30s because of the issues that comes with this condition, especially the issue with menstruation and then the issue with childbirth, fertility problems. So we tend to see them mostly around that age, in the 20s and then the 30s.
Okay. If you're mentioning the 20s, then it means that because a lot of the girls these days get their periods from as far back as 9 years, 10, 11, 12, 13. So does it mean that you can, as a teenager, you can go up, start getting your period, they'll be normal, but it will get to a point your body will start to store the ovaries and they'll create PCOS?
Yes, that's exactly what I'm saying.
So it's not like a condition that you are born with or
No,
it just happens because...
No, you are not born with it. So as you start menstruating and you
Okay.
start ovulating,
Okay.
then you start forming the cysts.
Oh, okay.
And once you start forming the cyst, as I said, releases certain hormones, endocrine hormones. And then that's what eventually will lead to the issues with your menses and then also the fertility problems.
So I'm emphasizing that particular question because a lot of the, I don't want to call it myths, but misconceptions around reproductive health and when it comes to women has to do with people thinking that, oh, maybe then she did something. Or maybe it's because of a certain lifestyle that you're living. That's why you're experiencing something. Or some people even say that it's because of promiscuity. If you are a young girl growing up and then you're promiscuous, or you've had an abortion, or you've done this, you've used certain contraceptives and things like that, it may, lead you to getting some of these things. That's why I want us to establish that
Yeah, so this is not a condition that is that you are born with, or that is related to any spiritual cause, or maybe an infection, for example. It's a condition that arises in certain women who are in their reproductive age and
Okay.
then have their menstrual cycle and then start ovulating. So it has nothing to do with any of the things that, or the
People
myths
think,
that people think. Yeah,
right.
exactly.
So, on that same tangent, is there a link between obesity, diet, and PCOS?
Yeah, so really, because it's an endocrine problem, you have it getting worse, especially in patients who are obese, for
Okay.
example. So obesity tends to make the condition worse. So as part of even the management of this condition, one of the things that we usually tell our patients is for them to lose weight, because the if I go, the fat is converted to set estrogen, which can worsen the condition itself. So we also advise them to, if possible, eat a healthy diet, okay, a balanced diet, but it should not be something that invariably may lead them to becoming obese.
Okay.
And then also, we also look at even that aspect that has to do with diabetes, because one of the issues with this condition is the what we call insulin resistance.
Yeah.
Some of the women have that condition. So dietary implications are there. Obesity is also a problem. So any of those things can invariably can worsen the condition. So we try to manage those things as part of managing the condition itself.
Right. So, you mentioning insulin resistance and diabetes and all of that brings me to, what should anyone look up, out for as a woman? What should you look out for to suggest to you that this is a condition? Because growing up, we've been told that, yeah, as a girl, when you get to a certain age, you see your period and it means A, B, C, D. Periods are not cancers. They are not things that will make you ordinarily stand up that I'm going to the hospital to check on my period. And I'm not sure if I come to the hospital without any complaints that I'm coming to check my period, I'll even be taken like very seriously, unless it has to do with something. So what are the symptoms? What should alert me to decide that, okay, I need to see a doctor to check what's happening with my periods?
Thank you very much. So there are a few things that every woman should be aware of. One of the things that would bring them mostly to the clinic is problems with their menses. So what happens in this condition is, because they are not ovulating naturally, their menses may just go off,
Okay.
sometimes for 3 months, 4 months, and then that will bring them to the hospital, and then we do the investigation and we realize that they have PCOS. So if any woman, every month you are supposed to have your menstrual cycle. Okay. So at any point in time, if your menstrual cycle is becoming irregular or is not even coming at all, you should come to the hospital for us to first of all rule out pregnancy, and then we'll do other investigations to find out whether it is PCOS. And then the other thing is what we call the androgenic effect, hyperandrogenism. Just to break it down, what happens is that they tend to start developing features that are typically characteristics of men or males. So, for example, they may start developing hair on their face, hair on their chest, hair on their abdomen, and these are things that typically you would not really find in a woman.
Yeah.
So those ones are there. And then they also have changes in their body weight. For example, they may start to become bigger, gain weight. Okay. And then the other key issue is also issues with fertility. So if you are having problems with fertility, it could be that the underlying cause is this condition. Because as I said, with this condition, you are not ovulating.
Releasing eggs.
You are not releasing eggs. So getting pregnant becomes a problem for them.
Okay.
So these are some of the common things that you have to be aware of.
Okay, so irregular periods.
Yes.
Does it make periods painful? Because I was asking that how does this have any similarities with endometriosis, which is painful periods? Is it also like a factor that you should take note of to visit the hospital?
So generally, for menstrual periods, you may have a bit of pain. Typically, the first, second day, there may be some pain, but this pain is not so severe as to limit your ability to go through your daily activities. Now, for this condition, because you are not really having your menses, pain is not an issue here.
Okay.
Okay. I agree that endometriosis can lead to very, very severe menstrual pains.
Yes.
But there are other causes, of course. But this one, because you are not even having the menses at all, yes, so pain is not really an issue with this.
Okay. So my next question has to do with management, or if there's a cure for it. I'm not, for a lot of the menstrual conditions or the reproductive health conditions that we've spoken about, like fibroids, like fertility issues and all of that, mostly they would say, oh, it's just management or lifestyle changes. So I would really want to hear how PCOS can be managed or be cured. But we'll do that after the break. Still watching Health Focus on GhanaWeb TV. My name is Stella J. So then I've been talking to Dr. Baidu about PCOS. Before that break, we're going to talk about treatment options or any way to manage the condition or even cure it. So are there treatment options? Is it curable?
Okay, thank you. So for this condition, as you rightly said, there are various ways that we'll be able to manage the condition for you. So most times we look at what is the issue with the woman. Is it as a result of the menstrual irregularities? Is it as a result of infertility issues, or she has signs of hyperandrogenism, as I mentioned before? So the treatment modalities really depends on what she has. But the first thing really that we advise them is that the women who are obese or who are overweight will have to reduce the weight. Because as
I hear some people say that, like, when you're dealing with PCOS, weight loss becomes very difficult.
Yes. So it's so in terms of management, it's not only with the doctor. It becomes a multidisciplinary way of managing. You even need a dietitian, you need a physiotherapist to even help you with exercises, etc. So with the issue with the weight management, I know it's a very, very difficult thing because it also has to do with lifestyle.
Yes.
And for somebody to change their lifestyle is very difficult.
Especially when you didn't contribute to you gaining weight. Some people stop eating, but they are still gaining weight. So what will you do?
So that's why I'm saying it's a gradual process.
Okay.
And it's multidisciplinary. You need other people to also help you in doing this. And sometimes you also have to know yourself. There are certain things or certain treats that you may may be eating that's maybe affecting your weight, for example. So that's really the first thing. Okay. Weight loss for those who are obese. I understand there are some women who may have this condition who may not necessarily be overweight or anything like that. Then the other thing is also to correct the menstrual cycle. Okay, so with that one, there are medications that we can give for you to start having your regular periods. So for women, for example, who are not ready to have a family, most times what they want is for their periods to be what? To be coming every month.
Yeah.
Okay. So we tend to put them on certain medications. For example, we may put them on contraceptive pills, for example, to regularize the menses and make sure that every month they menstruate.
Okay.
Okay. Whilst they do the other management, like the weight loss, for example. And then also, there's also that group of women who would also want to get what? Pregnant.
Yeah.
Okay. And because they are not ovulating, we have medications that we can give them to cause the ovaries to release an egg every month. Okay, so that they can what? Have pregnancy and then go through childbirth.
Okay.
Then so those are the modalities. And then also we have the women who have the excess androgens, like the male features, etc. So there are ways of managing them, like waxing or shaving, and then we can also put them on medications also to manage that.
Okay.
Now, let me also say that, there are other metabolic effects, endocrine effects for this condition. Some women may have insulin resistance, and so we'll have to put them on medications for that.
Okay.
So, for example, they may be put on metformin to control that issue. And then some women also have what we call dyslipidemia. So they have problems regulating their cholesterol as a complication of this condition. So that one too, if it is realized, we treat that one as well. If there are any other issues that are related to this condition, we treat them.
Okay.
There are other high-end things that we can also do. Like, for example, we can destroy the cyst in the ovary laparoscopically. That's a surgical,
surgery?
Yes, a surgical procedure to deal with that. So really, those are the management options that we have for this condition.
Right. So, I'm just curious about the surgical procedure, because the eggs come every month, and so they are developing. If you remove it, they'll come again.
Yes, we don't remove the entire ovary.
Okay, does removing your ovary help?
You see, it all depends on what the reproductive.
Yeah. Ovary? Which one is the ovary?
This one is the ovary. So
just say the always egg. There.
Just say the egg. Yes, it's always there.
No, wait. So is it the same as the egg?
Yes. No, it's different. This is the organ called the ovary. The egg is what the ovary releases every month.
Oh, okay. So can you remove your ovaries?
Yes. So you see, it depends on the ovary. Is not only there to release egg; it has other functions. So it depends on the age of the woman, her reproductive wishes, whether she's completed her family or not, and whether this is giving her severe symptoms that she cannot deal with. But what I'm talking about is, we call it laparoscopic ovarian drilling. So basically, we just use a device to just destroy the cysts that are there and leave the egg behind, so that the egg can go through its normal function. Remember, I said that it's the cyst that is causing the problem. So if you reduce the number of cysts, she would be a bit better.
Okay, so what's the success rate with that? Like how effective is that?
It's very, very effective for those with severe PCOS. It's one of the treatment modalities, especially when you do all the other things and she's not improving. Then you can do that.
Yeah, so I forgot to mention this. You mentioned how obesity puts you at risk of getting PCOS. What are endocrine conditions can put you at risk? Because you also mentioned diabetes. Do things like having, some people naturally have high cholesterol levels, they have high blood pressure, they are diabetic, and all those underlying conditions. Do any of those things put you as a woman at risk of getting polycystic ovaries?
Okay, so the the diabetes, dyslipidemia, and then the hypertension are more of a complication of the condition.
Okay, so not the other way around.
Not the other way around.
Okay. Okay.
It's more of a complication.
Right. So talking about treatments, how affordable or how expensive is treating PCOS? Like,
yeah. So I think lifestyle changes is
expensive.
It can be expensive, but it also depends on the individual.
It is expensive. And I think a few days ago, when I was preparing for this interview, I chanced upon a video where someone was talking about she has PCOS and then she takes some supplements for it. Is it advisable?
Which supplements exactly?
Like those pills and gummies, there are vitamins, supplements. Some of them help weight loss. Some of them help you to manage your diet.
So if those supplements are to help you lose the weight and then also not for you to have any vitamin deficiency, then I'll say it's fine. Because you know that when you are going through these weight loss sessions, you have to cut down your portions. Some people may go to the extreme that they may not even eat for
some people don't eat
some days, and they are likely to have vitamin deficiencies, etc. So it's a good way to go. Exercise is also a good way to go as well. But basically, it has to also do with the kind of food that we eat. So foods that are likely to cause spikes in your sugar level, for example, a lot of carbohydrates. Those are foods that we want to reduce. So that you can reduce the weight. But we are not saying that reduce the weight all of a sudden. That's the problem that some people may have. Immediately say weight loss, they want to lose all the weight in like a week. And that may cause problems or more harm. So it's supposed to be over a period of time. And sometimes that one alone can correct the issues with the menses and then the ovulation. Yes.
So exercise plays a major role.
Exercise is a good way to go through when you have this condition.
Right. You were going to say something?
Yes, and then in terms of the treatment expenses, it depends on where we are.
Okay.
For example, weight loss, these are things that I think we can sort of do at a less cost, for example. Medications to treat the menses are also readily available and they are not expensive at all.
Okay.
Medications to treat the ovulation. That's the drugs that we give to induce ovulation so that you can get pregnant. They're also available, not so expensive, but in case those modalities fail, then, the cost implication tends to go higher.
Okay.
Because if, for example, if we do ovulation repeatedly and it's not working, then we may have to go a step higher, and that may be a bit more
So
expensive.
you're advising early detection.
Yes.
And early treatment.
Yes, early detection, early treatment.
Right.
And if you have this condition, you get the necessary care as early as possible.
Right. So let's bust a myth. People say that if you have PCOS, you can't give birth. And a lot of women start getting scared immediately they hear that, what they have could be PCOS. How true is that?
If you have PCOS, it does not mean you cannot give birth.
Okay.
It does not mean you cannot give birth. As I said, it may make childbirth a bit difficult because you are not ovulating and you are not having your menses. But there is help.
Okay.
There's a lot that we can do to ensure that you get pregnant and then you have your children. So it does not mean that automatically you cannot give birth. There's treatment for
having
such women.
PCOS does not mean that you cannot give birth. Don't let anyone lie to you. Okay, that's what the doctor said. I'm not the one saying it. Also, can we talk about the mental toll that it has on the people? Sometimes some people experience fatigue. Some people are just tired, because of the hormonal imbalances. You may not be able to function, like the way you would if all those things were not involved. So can we talk about, is there help for people battling PCOS? What can they do? And as a society, what should we do? Because this interview or this discussion is also to address the education gap between people who have it and those who do not know anything about it. So now that you know, if you cite or you see anyone with said condition, what can you do to offer a helping hand to the person?
So, first of all, this condition is just like any other medical condition. There is help available. And any woman who is having this condition needs all the support that they can get from the family, from the husband or the boyfriend. One of the things that is a bit distressing with this condition, especially, has to do with three main things. Okay, let me say four. So one, with the weight gain, which on its own affects how the woman views herself.
Yeah.
Okay. And then also the other thing also has to do with the androgen effect, where she may have the hair on the face and all that, and these are things that some people may look at it and then may behave in a certain way towards them. But so our society has to understand, or we all have to understand, that it's just like any other medical condition, and there's treatment available for those issues. And then the other two key thing has to do with the fertility bit.
That one.
Yes, it can be a big issue.
Yes.
And marriages have been destroyed, relationships have been destroyed because maybe the woman has some difficulty getting pregnant. So you really need the support of the family, as well as the husband or whoever she is with, for them to understand that with this condition, these are the things that can be done for her, and she can live a normal life just like any other person. There are people with PCOS who have given birth to so many children, just being on treatment.
Are they able to carry pregnancies to full
Yes,
term?
they are able to carry pregnancies to term. So, of course, when you get pregnant, you definitely will have to see your specialist for you to manage the condition.
Pregnancy.
Yes. And the other thing also has to do with some of the other endocrine problems, like the hypertension and then the diabetes. So all these things come together to make it a big social issue. It may be a bit financially draining as well, because you have to be on medications for a long time. You may have to be paying regular visits to the hospital, and you may have to go through certain procedures that may be a bit expensive. So the financial implications are there, but they need the support of everybody. They need the support of everybody, and we should view them as women, just like any other condition that you can get as a woman.
Right.
Yes.
So, by way of inspiration, what would you have to tell? Because people who have PCOS don't have it written on them that they have PCOS. Some people live amongst us, they are normal, but it's only their pillows and their beds that know that they are battling something. So, if you have anything to say, what would you say to such a person?
Yeah, so the first thing I would say is every woman should visit their gynecologist, whether you have a problem or not.
Oh.
Yes, whether you have a problem or not.
This one, dear.
But,
stopping us.
But yes, the what I would say is that there is hope for them. there is hope for them, and there's a lot that we can do to help them and make sure that they go through life without any issues. And then also, anytime a woman has any changes in her reproductive organ, you have to report to the hospital, and you have to report early, especially if it has to do with changes with the menstrual cycle, any other change, abnormal discharges, maybe severe pain during the menses, etc. All these things should be evaluated by a gynecologist, and then the necessary treatment offered. The problem is sometimes we tend to delay the care.
Yeah.
And the longer you delay, the worse the
becomes.
problem becomes. So I would advocate that at least every woman should, even if you do not have a problem,
Just
see your
visit
gynecologist.
All right. All right. Thank you so much, Dr. Beidu. And in his words, I know he's talking to me too, but I hope we can all hear that whether you have a problem or not. Since you're a woman, you need to visit your gynecologist. And that's a wrap on today's discussion on PCOS. Remember, knowledge is power. Your health is your wealth. And always remember to visit the hospital when you have any symptom at all, or even when you don't have any symptom at all, according to the doctor. I'm not the one saying it. My name is Stella J. Jomsoli, and I've been doing this with Dr. Francis Beidu. He's a specialist of obstetrics and gynecology. And stay informed, stay healthy. I'll see you in another discussion. Bye.